Would you say that nurses still eat their young?
Patient went to the bathroom and boom, they're on the floor.
Cardiac arrest?
Cardiac arrest. They would try to give me like the most difficult assignment. And it's like, okay, sure, whatever. This is all you got. Like.
Hey guys, welcome back to my channel. If this is your first time here, welcome. My name is Sarah. I'm a family nurse practitioner, and I'm so excited for today's video because I get to interview an ICU nurse. So her name is Tammie, and she's been a registered nurse since 2019 and working in the ICU since 2014. So today she's spilling all the tea on working in the ICU, and she's going to answer all of my juicy questions. So let's go ahead and get started. All right, everybody, welcome to Maya. Hi, Tammie.
Hi.
So let's jump right into questions, okay?
Okay.
All right, so can you tell me about your journey to become an ICU nurse?
My journey, it was a little different. I wanted to become a nurse. However, I was working like very vigorous hours as a manager for a company. And I couldn't go back to nursing to school because of the program was very vigorous as well. So I ran into a young lady who came into the business that I worked for at the time, and we had a conversation, and she just said, I wish you could work with me. And I'm like, okay, well, where do you work? And she said, oh, I'm a manager for, an ICU, nurse manager. And I'm like, oh, interesting. That's what I wanted to do. So it's just by chance that we met up with each other and had the conversation. And then it went from there. She said, well, if you get certified or, you can come here and work as a tech and go to nursing school. And I'm like, okay. And found a class and did a 2-week certification and went from there.
The rest is history.
The rest is history.
So how long did you work as a tech before transitioning to the RN role?
I worked as a tech for 4 years throughout my whole nursing program.
Okay. How was the transition from becoming a tech to a nurse? Was it like an easy transition for you because you were already exposed to everything already? For
me, it was an easy transition. Just because I was a tech in the ICU and I just transitioned over for the same unit as ICU nurse. And I had a lot of insight on what that looked like prior to. So I believe it actually was an easier experience for me than a nurse coming directly out of nursing school going and finding a job
and being thrown into the deep end. Yeah, 100%.
I kind of knew what it looked like.
So you got that advantage.
Oh,
That's nice. So can you walk me through a typical day at work for you?
Typical day, it varies. Just depends. You walk in, you kind of don't know what to expect because our patients can vary from someone just, sepsis, they're ill, they're on antibiotics, we're, hydrating UTIs, things like that, to like trauma, vehicle accidents, broken bones or lacerations, open abdomens, open hearts. So it varies. You really don't know what you're walking into. You just kind of come in, you get your set and you just go. It's like, all right,
let's do this.
Yep, let's go.
Do this. So do you primarily work in medical ICU or surgical ICU?
So right now I do both.
Okay. So
it just varies. I'm either one or the other, just because I'm I went to contingent and I'm contract contingent, so which means I can go to either one, wherever I'm needed.
So let me ask you this: Do you have a preference?
Medical ICU.
That was my preference as well.
Yes.
That was also my preference. Yeah, there was a lot of drainage and all sorts of things going on in the SICU. Yeah. Okay. So medical ICU. Is it because you just prefer those types of patients, would you say?
I think more so I'm used to that environment more. And it's slightly different. It's all the same, but there's some differences for sure. Especially when it comes to, like you said, the wounds and like you said, the drainage. The trauma, it's a difference. I think medical is more contained. If it's a stroke patient, it's a stroke. You kind of know, okay, XYZ, it's straightforward. But when you have a trauma, it could go from one spectrum to the next.
Yeah, it's too unpredictable.
It is very unpredictable. Some people like that unpredictability. Yeah. I kind of like my organized chaos. I can do the chaos, just organized.
Exactly. Yeah. So what has been your most unpredictable moment in the ICU? I know it's filled with unpredictable moments.
Ooh.
Is there one that just really stands out to you?
Hmm. I've had quite a few
Mm-hmm.
unpredictable moments. Yeah, I've had, a patient that everyone's like, oh, that's the most stable patient on the unit.
Mm-hmm.
Like they're transferring out. We're just waiting for transportation. And patient went to the bathroom and boom, they're on the floor.
Oh, cardiac arrest?
Cardiac arrest.
Wow.
They were ready to transfer out of the ICU. They were doing perfectly fine, moving about.
Mm-hmm.
Everything was fine until, but now you've got the situation where they're on the floor and you're trying to do CPR on the floor, then
Oh,
get them in the
God.
bed.
Yeah.
That to me was the most unpredictable. It was
Because it
unexpected.
was
You
so
just didn't see
sudden.
it coming. It was so sudden.
And then in those kind of moments, you really just have to kick it into gear,
You just,
know?
yeah, you just go. You're like,
Mm-hmm.
okay,
Let's do this.
yep.
So, what made you pick the ICU versus a different specialty?
I believe being a tech in the ICU helped a lot.
Mm-hmm,
And
mm-hmm.
then during like the nursing program, you're going through your rotations. You kind of get to see different aspects of nursing. You'll get your respiratory units, you'll get your infectious disease, or like you do endo, or
Mm-hmm,
you do all these different specialties, and you're like, oh, okay. And I think hands down, like ICU was, to me, it stood out the most.
Yeah, 100%.
It varied. It wasn't like boring. I wasn't going to get bored. It was going to be something different all the time. I wasn't going to do the same thing every single day. So, oncology, there's certain meds that you're gonna see. ICU, there's the large variation of what.
So you actually didn't have to go through the whole med surge first.
No,
Lucky you.
no.
Lucky you.
I kind of scapegoat through
Yeah,
that
you
part.
really did. Good
Yes,
for
yes.
you. With your ICU training, when you do you get pulled to other units?
No,
Oh, you
no,
don't.
no,
Oh,
no.
okay. Because I was
Just
gonna say, do you
ICU.
feel that you could pretty much handle pretty much any situation? Even still, do you feel that you could handle pretty much any situation and work on just about any unit in the
Yes,
hospital with your ICU
absolutely,
training?
absolutely, yes.
Mm-hmm.
Once, especially in a level 1 or 2 trauma
Yeah.
ICU, you can pretty much go anywhere. Like
Yeah.
you've seen it all. You're like, okay, yep, all right. I
Mm-hmm.
think
Mm-hmm.
the hardest part would be prioritization when you have more patients. Because
Yeah.
ICU is usually 2 to 1, 1 to 1. You may have 4 to 6 patients. Now that's where the difficulty would come in, and that's just kind of like getting everything prioritized to make sure
Yeah.
it runs
Just making
smoothly.
that
Just
adjustment.
making that adjustment.
And then hopefully they wouldn't be as sick.
Right.
So hopefully.
Right.
Depends.
Now, I did have an incident where I went down to the emergency department.
So how was that experience? How
Oh
was
no,
that?
I would never do it again. Hey, I give shout out to all the emergency nurses.
Mm-hmm, mm-hmm.
That is unorganized chaos.
Yes.
And yeah.
Yes.
I think I ran around the whole 12 hours like a chicken with my head cut off. I'm like, okay, all right, okay, all right. Do this, do that.
Uh-huh.
Yeah.
I always told myself, like, I feel like I would love to be trained to work in the ER. Do you agree?
There's really, they really don't train you. It's kind of like, they kind of like, all
just kind
right.
of throw you in.
Yeah.
Yeah, no.
You're in triage, or you're in TCU, and you're like, oh, okay, that should be fine. No, you're going to have like, and typically if they know that you're coming from like an ICU, you're going to get like the vented patients. You're going to get like the worst of the worst, the traumas. And so you're really like overloaded with these patients that need one-to-one care. However, you've got like 5 or 6 patients that you're seeing to, and yeah, it can be overwhelming.
Yeah. So that does not happen to you often.
No, I actually went to help out.
Oh, okay.
And I'm like, oh yeah, I'll come down and help, you guys.
Mm-hmm. Bet you won't be offering that anymore.
I said, never again. I'm going to leave this to the professionals.
100%.
I was, out of my league.
How do you handle stressful situations at work?
if you can get a second to just step away, you step away. I think that's the best way to handle that. Like if you feel overwhelmed or you're getting to that limit, if you have the opportunity to take a few moments, and it could be 2 minutes, 5 minutes, to just step away for a second, recoup, come back. A lot of times you don't get the opportunity to step away. You just kind of push through it. You think like, okay, this is temporary. Like this is a situation that's occurring, and you work through it. You figure it out, and you make the best out of it. Just kind of get through it.
I remember, being in the ICU, and there would be moments where, like, my insides were like, "Oh my God!"
Yeah,
I cannot
but you
believe
can't
this
show
is
it.
You can't
You
show
can't
it.
show it.
You
You're
can't
like,
show it. Like the poker face is real, and we just move and do what you got to do. What you got to do.
That's it. That's it.
Yeah, I think ICU nurses are probably pros at the poker face and handling those stressful situations.
Definitely. And you don't want to have too serene of a face, because then people are looking at you like, oh, you have no feelings.
Yeah,
like,
yeah.
And it's like, no, like
that's not it.
That's not it. They're all in here. It's just, I have to be strong, because if I lose it, then everyone's,
yeah, you're kind of holding everything.
You're holding everything together. Like, if they see you, they're gonna be like, well, if she's losing it right now, we have no hope,
Exactly, exactly, because they are looking to you. Set the tone. You set the tone.
Exactly.
Speaking of family, what are your experiences with family members? Would you say that they're overall positive, or 50-50?
Okay, that I do believe the nurse really sets the tone for that experience as well.
Okay.
Because you're gonna get people from all walks of life. Some people, just coming into that environment alone is stressful for them, and they may not be themselves when they come in there. They may be a little, upset. They're upset with everybody, like, what's going on, why is this happening, they don't understand what's going on at the moment. It's a lot to take in. So I do believe that the nurse does set the tone for that environment for the most part. There's some things are just out of your control, and the best thing you can do is just do your job and just step away.
And you're a very upbeat and positive person, so I imagine you have very good experiences with family
My
members.
experience in general is very good. Like, I've gotten families where I've gotten report, and it's like, hey, just a heads up, the family's a little bit much, and just they're gonna be. I'm like, okay,
so you're mentally prepared.
I'm
but
prepared, and then you just walk in, and I try to explain everything that I'm doing as I do it, and it kind of eases that tension. And they're like, oh, okay, thank you so much for letting us know. Because for the most part, I believe it's like what they don't know is the uncertainty of everything. And so if I keep them abreast of everything as I'm going, and every little thing I do, I'm like, oh, I'm just going to listen to their lungs, or, oh yeah, I'm just checking the temperature, and I'll let them know, oh, there's no fever. They're doing good, and typically they're very appreciative of that. And
because some people don't take the time to explain those things. They just go in and are touching their family member, their loved one.
They may be more focused.
And sometimes that rubs family the wrong
way. Yes.
So I know you witness a lot of death in the ICU. So would you say that many of the patients' deaths are preventable?
In our demographics, a lot of our patients, once they get to the point of the ICU, when they come in, they're pretty far, gone. They're pretty, like, there's multiple comorbidities there. They've got a lot going on. So we're fighting one thing, but there's like 3 other things going on that could ultimately be a detriment to them. So, you're just trying, you try your best to prevent that, the worst case scenario. But like, a lot of times I do believe that a lot of our patients, they come in with multiple comorbidities. So there's a lot of different factors
that have been going on for a long time.
Long-term,
and mismanaged or not managed
chronic
at all.
Ailments and end-stage ailments, You'll have someone that, they came in a DKA, diabetic. However, their heart failure, end-stage renal. So there's so many different things that can be detrimental to them.
Yeah.
So, I do believe that it's just our demographics in itself that a lot of things are not preventable.
Yeah. Does witnessing death still affect you emotionally, or do you feel numb or a bit desensitized to it?
Thankfully, not thankfully in that sense, but it does still affect me. I have always said when it comes to the point where I feel that I am desensitized, I think it's time for me to do something different.
Yeah. Yeah.
No, I'm still very much affected. Yeah. Oh yeah, especially when it's unexpected. It's someone that you believe that's going to make it through or pull through, and drastically something happens and you're just like, I didn't see that coming. You're not prepared, or if you've gotten a bond with that patient or the family, and then this, it happens. It's just like, yeah, no, it does still affect me very much so. And like I said, if it starts to become a thing where I feel desensitized, I'm gonna change. It's time to do something else in the nursing field.
Yeah, it's interesting because I feel like I became more sensitive as I got older, because I would see family members and I would see myself in these certain situations.
Absolutely.
It's strange, after having kids, I became more sensitive. And I'm like, oh, I cried. I had to step away a few times, and isn't that an interesting thing?
I feel like that's the human thing. It's when like when you can put yourself in that person's perspective, put in that person's shoes and say, okay, this could be my son, or this could be my mom, or this could be, and that's just how I look at things. And I believe that's why I haven't become desensitized.
Yeah.
Because I always look and I see like somebody that I know in that person, and then that just
it changes. It changes things.
It does.
I remember I saw it was a last conversation with a mother and her two children. It was a boy and her son and daughter, and they were saying goodbye to her because they were going to terminally wean her, and I really teared up, and I had to step on the other side of the curtain because I have sick family members who are very ill, and I saw myself having that conversation, and I had to really compose myself in that moment. So you do put yourself in those.
Like, how would I be in that situation? Like, my son went to the hospital, and I went, I'm running there, and I'm thinking like, I was not a nurse. The nurse in me went away.
Yeah.
And I'm like, Mom, and that's it.
Yeah.
I forgot everything about nursing. It was just like,
that's your baby.
Yeah. So that goes out the window, and you're just like, this is my loved one, and you have to put yourself in that person's shoes. And I always tell new nurses that, like, precepting new nurses, and you have to tell them like, just think of this as your loved one. If you don't have children, your cousin, your aunt, your uncle, your mom, grandmother. If you think of it or look at it in that way, you're going to have a different viewpoint. You're going to have a different perspective. Trust me. I'm like, trust me, you will.
You will.
You will.
I'm grateful that you do paint that picture for them because that improves patient care too. It
does.
Would you say that nurses still eat their young? Would you say that's still a thing? Or have those nurses retired now?
No, there's still some there. Yes, but not to the extent as it used to be.
Okay.
I believe that it's gotten a little more lax. Because before it's like, they're like on their case. And which now that it's more of a lax environment, I kind of see the benefits of how they did that and why they did it. Because we do, like, now things are different. Like, after COVID, things changed. Nursing has changed.
It has.
You didn't bring in a new nurse directly out of school into the ICU.
That was unheard of.
That was unheard of.
Like,
now it happens.
Start.
It happens, and it happens more often than you think. And it's like, okay, they come in like, oh, I know, I got this, and really you don't. And it's like, before, people would say, no, you don't. What are you doing? You don't do that. Why would you do that? And it's chastising. However, I get it. Now it's like, okay, sink or swim. It's like sink or swim.
And do they oftentimes sink, would you say?
Yes. Yes.
So there was some benefit because there was
some benefit. Yes. Just because people watched out for things like, they're like, oh, you didn't program your pump. And it gets you conditioned to actually programming your pump. There's benefits to programming that pump, to the actual med that's running, and everything. A lot of times you can walk up and you say, oh, they didn't program their pump. Wait, but no one's like on their case about it.
Yeah.
And they'll tend to forget more often, I think. If someone was like really on them, like, hey, make sure,
Did you deal with any type of like nurse bullying or nurse intimidation at any point in your nursing career?
A little, not a lot, only because I was a tech in the same unit that I became a nurse in.
Yeah.
However, I did have nurses that would talk to me as if I was still their tech.
The tech, yeah.
And they would ask me to do things for them that a tech would do. And I'm like, no, I have my own patients, And so I did experience that in the very beginning. However, like for the most part, no.
Yeah.
Only because they knew me and they
knew who you were. Yeah, they knew you. Had worked with you for years.
Exactly.
That probably made the transition so much easier.
A lot easier.
Yeah. Would you say that the ICU is more easily accessible to Black nurses now than before?
Now, definitely more so than before. Before, I believe it was very rare to see more than maybe one or two Black nurses on a unit. Now, I believe it's like, I would say, if not a third, maybe even half on most units. There's still some facilities where it's very rare that you'll even see one, especially like places like the NICU or certain facilities out, more rural. It's very rare to see a Black nurse.
Yeah.
Especially during the day shift. You may get hired, but you'll be hired on the night shift where the families aren't there and, things of that nature. However, now, like, you see more Black nurses now in the ICU than you have before, for sure.
And we're thriving.
Very much so. And just in the nursing field in general.
Yeah.
I think prior, to, we'll say 5 years ago, I think more Black women, men and women, have gone to nursing school and achieved a nursing degree or even wanted to, or saw that as an option. They may have wanted to, but they just didn't see that as an option for them before previously. And now I believe that now they're seeing that for themselves and starting to, choose that field.
If you could change one thing about your job, what would it be?
I would say more support from the corporate end, as far as realizing what we actually do at the bedside and accommodating us in that aspect. The expectations sometimes can be unrealistic, which takes us away from the bedside, away from the patient care, and just more awareness from the corporate side of things.
So I remember it was some years back. The hospital was trying to adjust the ratio, the patient to nurse ratio in the ICU. Is that still an ongoing battle?
It's still an ongoing battle.
It is still. Okay.
It's still an ongoing battle. They would like to change it. However, there is still nurse pushback. But as you get the older nurses retiring and coming out, and the newer nurses coming in, that standard is not there. They don't realize, like, no, 2-to-1 ratio is a proper ICU ratio to give the adequate care. So it's still a push, but there's still a good nurse pushback. So it's still maintaining now. However, there are times where you will be tripled, but not as often, not very often.
Okay, good. Yeah. So not weekly. Would say nothing like that. Okay, and then the patients are lower, or at least 2 of them are lower acuity.
Typically, they are lower acuity.
Okay. Yeah, because I remember it was a big deal. And I saw that. I'm like, is this the future of
nursing?
Critical care?
Right?
Is this the future? It was scary.
Now, recently, I did just have a triple of all ICU patients. I had 1 surgical and 2 medical patients, and they were true ICU patients.
Wow.
And that was just a couple weeks ago, and yeah,
I know you
that
were
was
not
odd.
happy.
I was not happy.
You were not happy.
I managed, but oh my goodness, it was like running in circles. Like I'm like from room to room to room. Then I'd go back, boom, boom, boom.
Yeah,
So it was constant. And I mean, I managed, but yeah, that was a long day.
Can I ask you, what were the circumstances? Did someone call off? You didn't have the staff that day?
Yeah,
or?
it was a staffing issue, and then someone went home sick. She came in that morning. She was ill. She went home. So then it kind of
fell on you. Yeah. Okay. Would you say that the majority of nurses that you work with, or even that you train, have the goal of just getting some ICU experience so they can go on and go back to school? Would you say the majority or a large percentage of them, or no?
Nowadays, I believe half. At least half of them are coming in to get the experience to further their education or move on to a higher level in the nursing field. Yeah, so? I think it's like 50-50. You know, you need that experience to transition into that next level. So yeah, that's just part of it. You know what I mean? So it makes sense.
My goal was I just aspired to be an ICU nurse. I wanted to be an ICU nurse so bad. I felt that they were so smart. They intimidated me before, you know, because I worked on the OBS unit. It was OBS tele. And I would just, whenever I would like just run into a ICU nurse, I just thought that they were just the smartest, most, they could handle anything. I was intimidated. Like when I had to transfer one of my patients, I'm like shaking, giving report like, oh, I'm the patient. So it's a wonderful experience. And I admire ICU nurses. The time that I did do it was great. Yeah. I loved it. You know,
I love it. You know, I'm still there. I haven't planned to transition out as of yet to do anything different. I love it. I love what I do. We'll cross that bridge when we get to it.
Yeah. I say if you found a place, like even just finding a work environment that you can actually say that you love it, you don't mind the staff, management, the environment. Hey, I mean, there's so many people that they've never been able to find that place that they can be content.
That's difficult.
It's hard. It's hard. So if you find it, don't let it go too easy now.
I know, because you're dealing with a lot. You're dealing with a lot coming into that environment. The staff, you know, management, all those things play a part. And you do have to find that fit. I did travel for a while throughout other facilities to their ICUs. I did that for about a year, 8 months to a year. And yeah, it's interesting. The experience was so interesting. I did hold on to my position where I'm at currently. But yeah, it was very interesting. Like the dynamics of each unit or facility that I went to, I'm like, it's totally different. Completely different. The environment was just different. The way things were done were different. The type of patients we saw was different.
Oh, even the type of patients, huh?
Oh yeah. Just depending on the geographics, you know, like the things that they saw were like, oh, you got to see this, you know, and I'm like,
you were probably like, been there, done that.
That's nothing, you know. And I noticed like you would go to different places, especially you're like the visitor, because I did like this float pool, and they would try to give me like the most difficult assignment. And it's like coming from where I was coming from, it was like, okay, sure, whatever. This is all you got. Like, you know, like, oh, I've seen worse. You know, you come from level 1, level 2 traumas. Is like, oh yeah, this is a cakewalk. You're like, all right, you know, but the overall environment plays a big part. Just as far as you feeling comfortable, just to be there, to walk in, you know, just to walk in the door, you know, you have to have the right mindset coming in. Like, okay, you know, you have to be present, and to come into an environment, and, you know, the anxiety of just walking in the door, that takes you out of being present, you know. And so because I do believe you're too busy trying to adjust to
dealing with politics
and that, to me, I do feel like needs to be addressed in the field for sure.
I feel like I'm hearing a lot more nurses saying that they quit nursing.
Yeah.
You know, they're just over it.
Because of environment.
Yeah.
Now you have your younger nurses coming in.
Yeah.
And it's more of a mean girl environment. You know, so now you have a different dynamic, which,
that's,
you know,
actually probably
that's
even
gonna
worse.
be even worse, because at least with the elder nurses, like eating their young, they're actually trying to teach you something. and let you know, like, hey, pay attention. We got something to teach you here. There's experience behind that with the clicks and, everything now is more clicky and, so you have your groups and, oh, you don't fit into this group. So you're kind of isolated or you're, that type of thing is what you'll see more so now.
That's one thing I don't miss.
No.
But I work by myself for the most part, so I don't have to, deal with that. But I do miss the friendships and that.
Yeah.
I miss that. But that whole mean girl thing, there's nothing there's nothing I hate more than that. Because it affects every aspect of your job.
It does.
Even asking for help. To help, can you help me clean my patient? Simple things like that, it can even affect.
Can be an issue. Thank goodness I'm very self-sufficient.
Yes, you are. Yes, you are. So, because you have the background of being a nursing assistant.
Exactly.
So you have that. You're very self-sufficient.
And that works out for me very well.
Stay above the drama.
Oh yeah, I gotta stay away from, I have people that say, hey, you've been so quiet. I didn't know you were here. I'm like, oh yeah,
I'm here. Hello.
Hey, you need some help?
To switch gears, what are some things that you do to relax? I know working in the ICU is, highly stressful. So what are some things that you do in your spare time just to relax and just take a woosah?
Oh, self-care. Definitely self-care, hands down. Facials, massage, get out, food, just go eat, have a girl's day, or something like that. Any little thing that's self-care, hands down, I would say,
you're the self-care queen.
I'm like, okay, it's my day off, and then there's days where I just stay in, just stay in, you have a glass of wine, you put some movies on, and you just relax.
And you just relax.
Yeah, you do have to take that time out. You have to.
What advice would you give to someone aspiring to be an ICU nurse?
Do your research. Make sure that the ICU is something that you are truly, truly wanting to do. I don't believe it's for everybody. If you can have the opportunity to do like some shadowing or, rotations during nursing school to get into the ICU and just do your research. See if this is something that you really want to do, because it is definitely not for everyone. There's a lot of aspects that come into play when you think about ICU. I think people think, oh, I'm going to have just 2 patients and it's going to be fine. And, it's not what they always think it is. And a lot of times people come in and think like, this is going to be gravy. And I'm just going to, no, it's cool until it's not, until things go left. And then you got to be prepared and understand and know what that looks like and what to do when that happens. That happen.
Yeah. Well, thank you so much for talking with me today.
You're welcome.
You gave me some really good insight. If you have any questions, leave them in the comments. Thanks so much for tuning in today. Thank you for joining me.
You're welcome. Thank you for having me.
And I will catch you guys in my next video. If you liked today's video, don't forget to like the video, subscribe to my channel, and I'll catch you guys in the comments.